The American Red Cross has declared a national blood emergency as donations have dropped to critically low levels this summer, with hospitals depending on a steady blood supply every day. Officials are urging eligible donors to help. Joining us now is Dr. Courtney Lawrence to tell us more. Doctor, thank you so much for being here. So tell us, what are some of the factors that cause the blood supply to decline so much this summer?
Thank you for having me, Sasha. So the summer can be a particularly challenging time in the blood donation world. People are oftentimes going on vacation. Our adolescent teenage donors are not in school, where we have many of our blood drive operations. People oftentimes are either relaxing or being adventurous and not following their daily patterns. And so oftentimes making blood donation appointments falls off the radar for them. In addition to that, we've had several large-scale events happening in our major metropolitan cities between our Independence Day celebrations and major sporting events. All of those can cause an extra layer of complexity for blood donors.
Absolutely. And so we understand a little bit better how urgent this is. What kinds of patients depend on blood donations, and what happens if that blood isn't available?
So really, blood transfusion is the backbone of medical care in hospital centers. We can see patients who have cancer or other blood disorders like sickle cell disease that rely on regular blood transfusions to stay out of the hospital and be able to go about their normal daily lives. And then, of course, there are unanticipated emergencies, whether it's a complication in childbirth or a surgery procedure or an accident that happens outside of the hospital. People oftentimes need blood transfusions to save their lives. In a recent Red Cross survey, we found that less than half of those surveyed thought that they might need a blood transfusion or that someone near to them might need a blood transfusion. But the reality is, it's estimated about 30% or more of us will need a blood transfusion at some point during our lives. So it's far more commonly needed than people can imagine.
Oh, wow. And tell me, which blood types are most urgently needed right now?
So currently, we are really in need of our O-positive red blood cell donors and our B-negative blood cell donors. And that's because oftentimes Group O blood is the blood that's needed in many medical emergencies or unexpected transfusion needs. And our B-negative donors are a more unusual, more rare blood type. So those are our hugest needs, and for our Group AB plasma donors.
Okay. All righty. Well, thank you so much. Thank you for this important information. And if any of you want to make an appointment, the website is on the screen. Thank you, Doctor.
Thank you so much, Sasha.